Hi, this is Gypsy Jenny, and I am now going to heal one of my patients using spiritual energy, singing bowl, and crystals. Before I start my healing, I will normally heal myself first. And before I heal myself, I will thank the divine for giving me this gift of being able to learn Reiki. I will thank the divine, I will thank the Reiki energy for being with me, and I will ask the Reiki energy to come forward to help me heal my patient, which I will use her name. After that, I will heal myself. After I've done my healing, I will start healing her. So before I heal her, two things I will do. One, I will use the cleansing bowl to cleanse her aura from all negativity before I start my healing. Once I've done that, I want her chakra to be more able to absorb my healing better, and I want it to be more balanced. I'll use essential oil to balance her chakra, which normally I will just put at the third eye some oil. Then I will start the healing. Then I'll go for the eye, making sure that my palm, the center of my palm, touches the eye. This is the first healing step, which within my heart, I will say all the symbols that are required in Reiki. The eyes part is basically to make sure that to relax the person, to stay calm, and the more calmer the person is, the more the person is able to receive the Reiki energy. Why does people go for Reiki or spiritual healing? There's many reasons. Some due to emotional, some due to physical, and some due to mentally stress. So every step I will take about 3 to 4 minutes. After I've done that, I'll go to the temple. While I heal my patient, I also am able to detect what is happening inside her. Whether she is emotionally disturbed, mentally disturbed, having any physical ailments, or yet to come ailments. I'll go for the head. Basically, to make sure that mentally, if she's not energized or she's not strong there, to put in some positive energy inside her, and also to get rid of any negativity that is within her. The side of her head, and then direct on the crown. All about 3 to 4 minutes. The energy itself recognizes whether the person needs more energy at certain places in her, certain areas in her body. Then we'll go for the third eye. For me, for the third eye, I normally put my hand like that, but I like to use both sides. So I do more than the normal step that is needed to do spiritual healing. I make sure to cover every part of the body. I also will go for the jawline. Why is that so? Because we may have teeth problem or jaw problem that needs healing also. At the same time, healing the 7 chakras. Then I will go for the throat. After the throat, I will go for the shoulder. This is to help people who got shoulder pain, neck pain. There are a lot of people who don't make use or don't exercise, they do get frozen shoulders. And that's where I will find out whether they have arm problems or not. Then I will go to the chest area to double check whether she has any infection of the lungs, whether she is asthmatic or bronchital. It's basically like an X-ray, a scanning of the body. After I do the lungs, then I will go to the heart chakra. When I've done that, I'll go to the next step, to the solar plexus. What does the solar plexus basically is our confidence level. It's also in charge of our stomach area, intestinal area, and our center panels. After I've done that, I will go down to the side a while to check the liver, to check the pancreas, the two sides. Left or right? I will start either one first. After I've done that, I'll go to the abdominal chakra, or also known as the sacral. This one is also in charge of our self-esteem, our hormones, our reproductive system and all. Having done finished, I will go to the root chakra, which is at our groin, to check on her stability and how secure she is about herself. And from there, I also can tell her bone structure, whether she has any bones problem or not. Once I finish that, I will go down to her thighs. Sometimes I do two hands, one at a time. Sometimes I use like that. When I've done that, I will check the knees, both knees, to see whether she has any problems. Once I check that, finish, I will go to the shin. Both sides again, all about 3 to 4 minutes. Then I will go to her ankle. Sometimes she may have old injuries, ankle sprain. Sometimes old injuries, years to come, may cause you pain during rainy seasons and all. So I need to check and see whether anything is wrong with it. Then I'll put one hand at the sole and one hand on top to see how well is her foot in receiving energy. I now will go to my crystal. Besides healing spiritually, besides using Reiki, I like to use my healing stones, which already I've energized all my stones, to enhance the healing that she's receiving. In this case, I'll use the healer stone. These are called healer stone on her solar plexus. And this girl seems to have problem of the stomach and confidence level. And I will use one on her root chakra for stability. And she also seems to have a little bit of a bladder problem. And for women, I like to use another one at the sacral, especially for women, for self-esteem and productive system. In her case, I'm going to use all the stone as much as I can, only for certain areas. I'm also going to use another stone, which we call it the rose quartz, for all the blockages at the heart. Heart pain, being hurt, backstabbing, for all those that have hurt her. And she also seems to have throat problem, communications. So I will use the angelite. Sometimes I use the celestite. This being the rose quartz. Okay, I will use this on throat chakra. Only when it's necessary will I use for the third eye, which I normally do not use stones on the third eye, unless it's necessary. These are my stones that I use for healing. All the different stones that I use to heal people. So I will leave her like that, just for about 5 minutes, to let the stone that's already been energized, may the energy from the stone she'll be able to absorb it. While healing her just now, at the same time without her realizing it, I also balance her chakra. I'll take them all out. It's from the crown. I will go down all the way to her root chakra, test and see whether she's balanced. If she's balanced, then I will close up with the healing. If she's not balanced, I can balance her again using a pendulum. If I'm balancing her with a pendulum, I will start here to see whether the solar plexus is balanced. If it's balanced, it will stop by itself very quickly. If it's not balanced, it will just go round and round by itself, faster and faster clockwise until it stops by itself. It can go even further, round and round and round until it stops. So wherever which part she's not balanced is the part that I will do. And I double check. Or I can check by just holding here. Because our chakras move in a circle way, like a wheel. And if it's turning clockwise when it's supposed to be clockwise, anti-clockwise, I will use my hand and turn accordingly to influence it to go according to the right direction, whichever way that is needed. Every part. That's how we do our healing. This is Gypsy Jenny signing off.